The final facet of the system that we've developed is a mannequin and probe simulator, which allows us to teach people the practical skills of acquiring transesophageal echo images. From very basic anatomical correlations, for example, if I push the TOE probe down the patient's esophagus, we can see on the screen the position of the esophagus relative to the heart, and we can see just how the probe moves down and subsequently under the heart. It moves anteriorly as we advance the probe into the patient's mouth. The controls on the TOE probe reflect those that are on probes in common clinical use, from the wheels that control anti-flexion and retroflexion of the probe, and we have the usual buttons that will increase angulation of the ultrasound plane, decrease it, and reset to 0 if required. If we demonstrate on the model now how the TOE ultrasound plane is cutting through the heart, we can demonstrate both sides of the slice of the heart, so we can look down from this slice towards the apex, and we can also see how the ultrasound plane is cutting through the heart, looking up towards the atrioventricular valves. And as I'm pulling the probe back within the stomach, we can see we're passing some of the conventional imaging planes, such as the mid-papillary short-axis view of the left ventricle. We can see quite clearly now, as I pull the probe back into the esophagus from there, that we're achieving an ultrasound imaging plane that's orthogonal to the one we had just now in the stomach. And if we want to achieve a 4-chamber view, for example, I can see exactly how I'm moving my ultrasound plane relative to the heart. And as with a real heart, if I keep the ultrasound plane horizontal, I'm actually foreshortening my ultrasound image, and I will need, as with a real patient's heart, to retroflex the ultrasound plane so that it passes through the true apex of the left ventricle. One of the structures that we're very keen to teach people the ultrasound imaging of is the mitral valve, and it's one of the most complex structures to explain, and to explain the conventional imaging planes that we want to achieve, so that we can show surgeons, for example, what's happening in the operating theatre while they are either replacing or repairing the valve. So what we have here is a conventional 4-chamber view of the heart, and we can see with the blue ultrasound plane in the image exactly how that's cutting through the mitral valve leaflets. It's not a natural plane of the mitral valve that we're slicing through here, but we can orientate the ultrasound image according to the natural plane of the valve by rotating our plane of ultrasound to achieve, first of all, a commissural view. Having rotated the plane of ultrasound through about 60 degrees, we can see how it slices through the leaflets of the mitral valve, and how we achieve that commissural view on our TOE screen, whereby we see the posterior leaflet in 2 places by the annulus either side, with a small amount of the central anterior leaflet coming into our imaging plane as the heart moves through the cardiac cycle. It's so clear on the 3D model how we achieve this ultrasound imaging plane, something that's quite difficult to explain to people who don't have a very detailed understanding of the anatomy of the valve. If I wanted to know what one of the structures in my ultrasound image was, coming back to a commissural view, I might, for example, be interested to know where the left atrial appendage shows up on my TOE image. So if I'm not sure what that extension from the left atrium is in my ultrasound image, we can highlight it and it'll be emphasized in the 3D model. I can see clearly that that's the left atrial appendage showing up. And similarly, if I wasn't sure where the left atrial appendage would be appearing on my ultrasound plane, I could select it on the model and see it highlighted on my ultrasound image. This allows people to search the heart, to discover and explore how they can display particular structures clearly when they're performing a TOE examination, and also allows people to identify what the structures are in their TOE image. So we could, for example, freeze the image and highlight any part of the structures represented in it to see what the label tells us it is.